Class. Today I will be teaching about the topic Organization of Critical Care Unit. This topic is for BSc third years. So let us see with the physical setup of 5-bedded ICUs. So we know that in an ICU, okay, I think everyone has been inside the ICU. They have some experience of ICU, but it is respiratory ICU, or medical ICU, it's surgical ICU. So based on that, you must have seen the physical setup or the location. Okay, how many beds are there in one room, in one ICU, and what are the equipments present? Okay, what are the rooms that are there, like the storage room or the nursing station, okay, the patient's room, the utility room, the cleaning room. So all these are there in an ICU. So this is a picture of just to have an idea of what an ICU looks like. So there are many beds, okay, like there is one bed here, this is a patient room, this is second patient room, third, and this is also another patient bed, ICU bed. Then there is there's a bathroom here, then there is a storage cabinet where we keep all the medicines, the drugs, and the equipment, the articles required for providing care to the patient. Then we have the workstation here, and there is a central, the nursing station, or we call it as a central station. This is a place where the nurses, they perform, they sit and they do their work. Then there is according with this, there is a nursing toilet also, and there is a clean utility room. There is a boiling utility room. Okay, so this is an ICU. So many, different hospitals have different ICUs. Okay, so their setup is different, but this is an ideal one. So you can see here also. Okay, so some hospitals they have like this also. Okay, like there is a partition in between. Okay, like half covered, and in each bed there is a cardiac table. There is a cabinet to keep the things. So organization of ICU, the design of ICU. First, it should be at a geographical distinct area within the hospital with controlled access. So ICU should be present within the hospital itself. The ICU should not be away from the hospital. It means that the ICU should not be away from the surgical ward, or it should not be away from the OPD, the emergency. Okay. Next, there should be a single entry and exit. However, it is required to have emergency exit points in cases of emergency and disaster. So there should be only one entry and one exit. Okay, to go inside the ICU, and there should be apart from that, there should be many emergency exits just in case if there's any earthquake or disaster. There should not be any through traffic of goods or hospital staff. Supply and professional traffic should be separated from public transit. Means that there should be no congestion within the ICU. Okay. Then safe, easy, fast transport of critically sick patients should be a priority in planning its location. Next, therefore, the ICU should be located in close proximity or emergency room, OT, trauma, ward, etc. So the ICU should be close, should be just next to the emergency department, should be close to the OT department, should be close to the trauma ward or the surgical ward. Next, the corridors, lifts, and ramps should be spacious enough to provide easy movement of bed or trolley of a critically sick patient. So the passage, okay, or the corridors or the lifts, they should be big. They should not be small, they should not be narrow, but they should be big, spacious, so that there will be enough space to shift the patient from emergency ward to ICU, or from the OT to the ICU. Okay. Next, close, easy proximity is also desirable to diagnostic facilities. So the ICU should be very close to the blood bank, should be close to the diagnostic, the labs, okay, the investigation lab, and the pharmacy, etc. Just in case. Next, the bed strength. So it is recommended that total bed strength in ICU should be between 8 to 12 and not less than 6 or not more than 24 in any case. So the normal range of bed strength is 8 to 12. It should not be less than 6 and it should not be more than 24. Next, 3 to 5 beds per hospital bed for a level 3 ICU or 2 to 20% of the total number of hospital beds. So in 100 hospital beds, okay, so there should be at least 3 to 5 beds for a level 3 ICU, or it should be 2 to 20% of the total number of hospital beds. So that is the calculation that we have to maintain in a 100% in a 100 hospital beds. Next, one isolation bed should be there in every ICU. Okay, one isolation bed is kept in an ICU for there's any highly infected patient like HIV patient or hepatitis B infection patient. So like that also there should be separate one isolation bed. Next, the bed and the space. 150 to 200 square feet per open bed with 8 feet in between the beds. So that is the space between the open bed. Okay, the space is 150 to 200 square feet with 8 feet in between the two. So between two beds, the space that should be in between them should be 8 feet. 225 to 250 square feet per bed if in a single room. Next, beds should be adjustable, no headboard, there should be side rails and there should be wheels. This is very important because side rails are important to prevent the patient from having any falls, and wheels are required so that it will be easy to shift them to the wall and to bring from emergency department to the ICU. Then you have to keep the beds 2 feet away from the head. Okay, from the wall also, it should be 2 feet away from the head wall. So that is the space of the bed. Now coming to the accessories. So what are the accessories or what are the equipment that we require in an ICU? Okay, so 3 oxygen outlets, 3 suction outlets for gastric, tracheal and underwater seal drainage procedures. Next, 2 compressed air outlets and 16 power outlets per bed. Okay, so that is the standard number of having these outlets. Then the storage should be by each bedside. Okay, so every bed, by the side of the bed, there should be a cabinet or a store cupboard. Next, hand rinse solution by each bedside. There should be a hand scrub. In each bed, in each ICU bed, on the cardiac table, there should be one hand rub. Then equipment shelf at the head end. Hooks and devices to hang the infusions, blood bags extended from the ceiling with a sliding rail to position. Okay, so there should be hooks on the bed also, the ICU bed, and also on the sides of the wall. So there should be hooks so that we can hang the IV fluids, we can hang the blood transfusion bags. Infusion pumps to be mounted on stands or posts. So there should be IV pump stand. Okay, so that it'll be easy to give the patient infusion. Then level 2 ICUs, they may require multi-channel invasive monitors. Next, ventilators should be there, infusion pumps, portable X-ray unit. Okay, X-ray machine should be there, which is portable. Okay, that is portable means it can it is easily transferred. It can be transferable. Okay, it can go from one bed to another bed. So the X-ray machine should be portable. Then fluid and bed warmers, portable light, defibrillators, anesthesia machines, difficult airway management equipment are necessary. So there should be a crash cart. Your crash cart is very important. Next, so those were the accessories or the things that are required in an ICU. Next, coming to staffing. So first there are some medical staff. Okay, so the best senior medical staff to be appointed as the intensive care director or the intensivist. So the best senior medical staff of that hospital should be appointed as, or should have the designation of, or should be appointed as intensive care director, or we call it as intensivist. Then less preferred are the other specialists from anesthesia. Okay, so there can be anesthesia doctors, then from the medicine department who has clinical commitment elsewhere. Junior staff are intensive care trainers and trainees on deputation from other. So there are junior doctors also. Okay, senior representatives, we call it as SRs. Okay, the juniors, they are the interns, doctors, or the ones who are studying MBBS. Okay, so those also should be there in the ICU. Next, coming to the nursing staff, the major teaching tertiary care, ICU requires trained nurses in critical care. So, nursing staff should be the best, okay, should have very good knowledge about the critical care. Only then they are posted in ICU. Okay, so the ICU staff are the ones which have very good knowledge, or they have high knowledge of critical care. The number of nurses ideally required for such unit is 1:1 ratio, means that one nurse and one patient. However, it is not possible in many hospitals, and one nurse can look after up to two patients. Okay, that is acceptable. And sometimes because of shortage of staff or shortage of nurses in the ICU, therefore, because of workload or work statistics, it depends on the type of ICU and shortage of staff, so a nurse has to manage. Okay, or sometimes a nurse can get 3 patients. Okay, but the standard here is 1:1 ratio. Allied services. Okay, so the other health members of the ICU are the respiratory services, nutritionist, the physiotherapist, biomedical engineer, technicians, computer programmer, clinical pharmacist, social worker, counselor, and other supporting staff, security guards, and housekeeping staff, that is the grade 4 workers. So these are the other members in the ICU other than doctors and nurses. Now there's also another important role of a nurse, okay, that is a nurse manager in the ICU. This nurse manager should have a PhD degree, MSc degree in critical care nursing, and should have at least 2 years experience in critical care unit. Okay, so this nursing manager or nurse manager should have experience with health information system, quality improvement, or risk management activities, and healthcare economics. She or she should have the ability to ensure that critical care nursing practice will meet the appropriate standards. And also the important function of nurse manager is preparation to participate in the on-site education of critical care unit nursing staff. So this nurse manager should have the updates about the evidence-based practice or new technologies of ICU, and this is the responsibility of nurse manager to spread or to educate the nursing staff in the ICU. This is the important role of a nurse manager. Next, coming to the organizational model for ICU. So there are 3 models. One is the open model, closed, and hybrid. So the open model allows many different members of the medical staff to manage the patients in the ICU. Okay, so there can be many medical doctors who can look after the patients in the ICU. Closed model, it is limited to ICU certified physicians. Okay, those doctors which have experience in ICU, or they are called the intensivists. Okay, so only those doctors who have good experience in ICU, only those they will take care of the patients. Then that is closed model. And the hybrid model is a combination of open and closed. Okay, so by staffing the ICU with an attending physician or a team to work in tandem with primary physician. So these are the 3 models that the organizational models that are being followed in ICU. So that is the end of the topic for today. That is the organization of ICU and the physical setup of ICU. So I hope this is clear. Thank you.